So, have you ever come across a movie scene where you experience a health related situation and then you wondered, wait, is that real? Is that really true? Does it happen in real life? Welcome to your ERNS channel on YouTube. Today we are going to debunk some myths that happens in some movies. Okay, today we are going to take this movie, one of my favorites actually, starred by Brad Pitt, and then you know you would love the movie. I know you've seen the movie. Now in the movie there was this situation where the protagonist gets injected with a venom. Okay, of course, he also injects the antagonist with the venom as well. But then our point of focus will be on the scene where he injects the anti-venom into his neck, directly into his neck. Okay, so, and it starts working immediately anyway. But in real life situations where in the healthcare sector, this would have been a situation where we are giving medicine through the parenteral route of administration. Okay, we have routes of administration of medicine. We have the topical, the inhalations, and all that. Now, the parenteral route of administration requires that you use a syringe and a needle to pierce through the skin into any part that we want the medicine to get to. So we can have parts like the intradermal, intramuscular, subcutaneous, intravenous, intracardiac, intraarterial, and a whole lot. So usually medications are given through using the common routes of the intramuscular and then the intravenous. Now, this antivenom is probably being given through the intramuscular or the intravenous routes. Okay, and looking at the neck, we do not have that much muscles. Okay, that is one of the requirements of giving intramuscular, choosing a site to give intramuscular medications. The site that you choose should have adequate muscle tissue. Now, the neck doesn't have that much muscle tissue, so it is not a recommended site for administration of intramuscular medications. And if you're talking about going IV, that is intravenous, we do not have common or easily accessible veins on your neck, unless you're talking about the jugular vein, which is an emergency vein. We don't just use it for any medication at all. We use it only in emergencies. Injecting medicines into the neck, it is not recommended. It is not usually done. Now, here are three reasons why you can't use the muscles on your neck for an intramuscular medication. Now, whenever you are giving intramuscular medication, the first one is what I said, that we require where we have thick muscles so that the medicine gets enough muscles to spread across and then work gradually. Okay, gradually. That is how much the intramuscular medications work. And then whenever you are giving intramuscular medications, the dose of the medication, which is the quantity in the syringe or that we are using, it is what determines where we are going to give it. So if we want to give medicines which is more than 2 mils, we do not use even the shoulder, which is one of the most common sites that we use. Okay, we do not use the shoulder. You can either use the shoulder, the thighs, or the gluteus, that is the buttocks. We are saying that the likelihood of puncturing a nerve is high. So if you've heard of situations where somebody was giving medicine at the buttocks and the person ended up getting paralyzed, then that could be the reason. The person might have punctured the nerves there, that is the sciatic nerve usually. Now, if the third point also is that if we are to give IM medications, we do not just inject it straight up like the way it is done. When you get access into the muscles, you pull back to ensure that you are not in a vein or in a muscle. Now, here in this situation, we just choke and then we press it on, which is not done that way. And then let's say that we are going the intravenous route. Now, to give intravenous medications, there is an angle that is required to gain access into the vein. And this angle is usually 25 degrees or 30 degrees between that range. But when you look at the scene in the movie, you realize that she just goes directly into the neck like that. No angle, just 90 degrees, which is what is used for muscles, by the way. So now we can't say that we are in the vein, because even if it was going 90 degrees and we're going to get access to a vein, we will puncture through it to another side and then leave the veins and then gain access into the tissue surrounding the veins. So we won't get access into the vein. That means the medicine will not get into the vein but outside the vein. So it is not right to give medications, whether antitoxins or whatever, through the neck. It shouldn't be IM or IV. It is not recommended. If you want to take the jugular vein, then that is when in emergency, serious emergency, that we are not gaining access into any of the common veins occur. So if you've encountered this scene in a movie where they give medications directly into the vein, like you just enter and then push it inside and it starts working, and you are wondering or you are thinking of trying some, maybe you have no health background, but you want to give some medicine to yourself, and then you are thinking, okay, I can just give it through the neck because people give it through the neck. No, it doesn't work that way. The likelihood of you actually puncturing a jugular vein, which is a bigger vein that can bleed a lot, or going into the nerves, is high, because there is not enough muscles around that place to take the medicine and administer it gradually. So the recommended muscles that we use for iron medications are the shoulder, the thigh, and then the gluteus or the buttocks. IM sites for giving medications. IM medications are what you see on the screen. So do not go for the neck to give IM medications, and do not go for the neck to give IV medications just as you like, because it is very difficult gaining access into a vein, not as depicted in the movie where they just pierce it and then they assume that it is in. And if you look at the movie critically, you're going to realize that there is a very fine detail there where we don't see the medicine in the syringe. So, okay, so we can't tell the dose or how much is going to be given. But whatever the case, I can't even look at this needle and puncture someone with that on the neck. Like, imagine you have a patient and you just go to the patient and I'm coming to give you medicine and then just pierce it in the neck like that. Come on, it doesn't work that way. So it was just a movie and it was just a scene. But in real life, we don't do that. So don't go and then decide to try giving yourself medicine through the neck as a way of giving either intramuscular or intravenous medication. Do you have any other movie where you've seen a health related situation that you are confused about that you want us to cover? You can just give it to us in the comment section. And if you have any other additions to make, you can add up to it in the comment section. But by the way, don't forget to subscribe to the channel. Don't forget to hit the like button and don't forget to hit the notification bell so that you keep getting updated with every new video that we post on this channel. Until then, bye bye and enjoy your day.